So let me ask you this question. How far would you go to protect your family from the coronavirus? Would you, in order to keep your loved ones safe, well, would you sleep in a hotel room away from your family? Would you sleep in maybe a whole nother room, maybe in the garage? That's exactly what some medical workers are doing, and one of those doctors turning to those kinds of measures. Dr. Kara Guerin with Valley Wise Health Medical Hospital this morning. She's joining us live via Skype. First of all, Dr. Guerin, let me say thank you for what you're doing, because you are an emergency room physician, so you quite literally are at the front lines. And let's start with the description there. What is it like there in the emergency rooms?
Thank you for your thoughts and your support. Right now is actually relatively slow compared to our normal volume, but patients that are coming in really need to be there. We're seeing a much higher quantity of patients. In other words, the percentage of patients that are very sick are much higher. And patients that come in generally don't actually want to be there. They're very anxious because they know what's going on, and they know that actually coming to the hospital is not the safest place to be right now, but they need to get their medical attention.
Well, speaking of that very environment and that kind of anxiety, what does that do to your anxiety? Because obviously you've taken some extra steps here to protect your own family. So there must be something in the back of your mind here that thinks, I want to be extra safe as far as bringing this home or bringing anything home to my family.
Yes, my family and I decided that, especially as the coronavirus starts to peak, that due to my parents are elderly and they are both high risk. My husband is higher risk as well, and I have two children. The children are well, but as we know, children can be asymptomatic carriers. So while I could distance myself at my house from from the adults and from the children, even if I interact with the children, they could always take the COVID back to the other adults in the family. So we decided that it would just be best for me to leave. So I am staying. Diamond Resorts has been very kind and put part of their resorts just for healthcare workers who need to stay away from their family. And that does add a level of anxiety. Life is completely different for those of us who have decided to leave our house in terms of everything, in terms of where we eat and how we interact and what we do after we get home from a shift. The emergency department staff right now are great. More than ever, we are a family. We've always been a family, but more than ever, we're a family, very supportive of each other. And acknowledging and talking about how our personal lives have changed.
You know, Dr. Guerin, from one mom to another, I can't imagine being away from my children for an extended period of time. How are you holding up as a mom, physician aside, and how are your kids dealing with mom being away?
Thank you. I really appreciate that, because that's probably, I miss my parents and I miss my husband greatly, but not seeing the children is probably the most difficult part of this. I have a 1.5-year-old, and he seems to be relatively unaffected. He's happy with grandma and grandpa and dad, and we FaceTime a lot. And we read books on FaceTime together, and that seems to be sufficient for him. My 5-year-old really, there's a lot of changes right now. She's not going to school. She's not seeing her friends. And she has definitely taken note, and we've have a lot of discussions about why mommy is gone and when will mommy be back, and we're not really all that sure. So we've started doing a lot of different things. Last night, my husband, daughter, and I colored for 45 minutes on FaceTime. We showed each other what we were making, and mommy, why don't you have markers? Why are you only coloring in black? So we talk a lot about that.
Dr. Guerin, how do we even begin to say thank you, not only for what you do in your profession, but the incredible personal sacrifices that you are making to take care of those that are most sick and most vulnerable? You are in our thoughts and our prayers during this time, not only you, but your family as well. Thank you, my friend, for everything that you're doing for our community.
Thank you very much.